Thank you for joining us for this virtual town hall featuring your questions for Hawaii's senators about the COVID-19 pandemic. We'll join our panelists in just a moment through video conferencing. First, here's where we stand today as a state and as a nation. This week, the U.S. marked more than 100,000 deaths from COVID-19. That death toll and the continuing number of cases has some concern about a spike in cases and a second wave, now that all 50 states are in various stages of reopening businesses and economies. The economic impact of the virus has been unprecedented. About 41 million people have applied for unemployment aid since the virus outbreak intensified in March. The national jobless rate was 14.7% in April, the highest since the Great Depression. Starting today, outdoor operations like the water park and Kualoa Ranch on Oahu can resume business. Then tomorrow, Honolulu hair salons, barbershops, and other beauty operators will be able to open. Restaurants already received a green light to open on June 5th. Gyms, theaters, and museums are on track for a June 19th opening. Kauai County reopened most medium-risk businesses last week and hopes to get organized sports, parks, and restaurants open by June 1st. Maui County is allowing most businesses and services to reopen starting Monday, June 1st, and that's also when churches, personal services, and restaurants will open in Hawaii County.
We turn now to our panelists for this virtual town hall, Senator Brian Schatz and Senator Mazie Hirono. Thank you very much for both joining us.
Sure.
The first question, the CARES Act bills passed by Congress pumped billions of dollars into local economies. Can you talk about how that money specifically has helped Hawaii, and are you satisfied with how it's being spent? Senator Hirono.
I would say two of the really important parts to the CARES Act was support for small businesses, more support for small businesses. And we set aside some money so that the kind of businesses that you and I might consider small businesses would get more of that money. And the second part was, of course, the addition to the unemployment insurance benefits. So we really very much focused on what can we do for small businesses, what can we do for workers. It's not perfect, and that's why I'm really eager to get on with the next COVID bill, which, by the way, Mitch McConnell and the president are not exactly chomping at the bit to do. I can talk more about that later, but maybe Brian wants to say a few words about CARES Act.
And thank you, Mazie. Thank you, Gina, for doing this. The CARES Act was good policy in the sense that we understand that the government mandatorily shut down all businesses and shut down most economic activity. And so in order to do that without having people starve, we needed to support people. And that was with the expanded unemployment insurance and the PPP program. Both programs had pretty significant issues in the rollout. Especially with UI, I think it's worth remembering that we were really nowhere for a couple of weeks, even though there was this big windfall of federal funds. And credit to State House leaders and others who kind of jumped in there, set up a functional operation at the convention center, and are in the process of plowing through tens of thousands of claims to make sure that the 230,000 people who have lost their jobs are able to make their rent, make mortgage, and pay their bills. So the policy was right. The execution was a little clunky, but we'll get better as we go along.
There has been talk of everything from a second stimulus check to the HEROES Act, safety nets, and added stipends. What is the status of any next round of federal support for individuals? And realistically, what dollar amount and programs are most likely to get that bipartisan support and pass? Senator Schatz.
Well, I think the anchors of the original CARES Act ought to stay in place. That's the PPP, the Small Business Program, and the expanded unemployment insurance, as well as funding for governments, local governments, to make sure that they stay afloat. Because as we contemplate a reopening, it would be exactly the wrong time to cut middle-class jobs by laying off individuals who work for the government. It would also be unwise for us to try to be furloughing teachers or school administrators or school sanitation workers as we're trying to make sure that a couple 100,000 kids can go back to school safely. So one of my highest priorities, and Maisie and I feel both very strongly about this, is that we're going to need some money for our local governments. I know every state, red and blue, is going to be in a deep, deep hole, and we're really not in a position to recover as a country if in the middle of this so-called reopening, we're basically shuttering schools, firehouses, nursing homes, and hospitals. So we really got to get that, what they call state and local money, in the next round. As to when we're going to pass something, I think that's pretty nearly impossible to predict.
Senator Hirono.
Let me just add that the U.S. House, under Nancy Pelosi's leadership, passed a $3 trillion HEROES Act. And of that, $1 trillion is for states and counties to meet their budget shortfalls, because if that kind of help doesn't come, then the state is looking at a $1 billion shortfall. We're looking at programmatic cuts that people rely on, furloughing of government employees. The pain will be even more so, and that's why Republican and Democratic governors went to the White House, called the White House, and said, we need at least $500 billion to help us. So there's that. And frankly, the state house, the U.S. House has really taken up its responsibility, and it is extending the unemployment insurance program, because we know that with 40 million or so people across the country unemployed, with maybe 1 out of 4 in Hawaii unemployed, they're not going to just get back to these jobs. We're going to need to provide some extended support, and that could include also direct payments to workers. But as we know, as Brian noted, it is not as though the Senate President is all that eager to proceed. In fact, after we passed the CARES Act, both the President and Mitch McConnell said, well, now we can take a pause. As though the 40 million people without jobs, all the people in Hawaii, people standing in line for food at food banks, that they can take a pause. The only people who can take a pause are the President and Mitch McConnell's friends, who benefited from the $1.5 trillion in tax cuts that they didn't need. The rest of us feel a sense of urgency to get on with it.
On this next question, one area of relief that seems to have bipartisan support is the need to fix the terms of the Paycheck Protection Program. As we know, those who have it have to spend it in 8 weeks, and that was not nearly long enough, especially in Hawaii. Early recipients are literally down to their last week or two, and for changes to be made before their clock runs out. And the new recipients are deciding, should they even start spending it in the first place? When will those corrections, those extensions to that program, get to the finish line? Senator Hirono first.
Even as we speak, the U.S. House has already passed some fixes, just the ones you mentioned. We're going to lengthen the time in which they have to spend this money. And also we're making it a lot more flexible in how they spend the money.
Senator Schatz, your perspective on will those PPP fixes make it in time for those earliest recipients, and what more could glom onto that same bipartisan support and momentum?
We're certainly hoping so, and Maisie's got it exactly right. There's good bipartisan support in the Senate for these fixes. The one other fix that I'd mention is that there's a requirement in statute that you spend 75% of the PPP loan money on maintaining payroll, which sort of sounds good, but it really does depend on the structure of your business, whether lease, rent, and electricity may be a more significant driver of your monthly operating costs. So we want to provide that flexibility. There's not a lot of disagreement about providing that flexibility, because basically all of us went home, Democrat or Republican, and sort of got yelled at by our local businesses saying, thanks for this, but it's not really working. Could you fix it? So we're certainly working on it, and we understand that there's I believe, a early June deadline for, as you said, the businesses that got the loans first.
Right.
Next question. Many Hawaii residents usually work 2 jobs. They lost one during the pandemic. Some are lucky enough to continue to work the other. But Nelson Kina asks, is there anything that can be done by the federal government to assist people who've been furloughed from one of their 2 jobs and they don't qualify for unemployment benefits? Senator Schatz.
Well, let me speak specifically to a scenario like that. I checked with my staff a couple of weeks ago, because we had these questions coming in, and reductions in revenue should make you eligible for what we call the expanded unemployment insurance program. It's expanded in the sense that it's $600 additional per week on top of the state benefit, but it's also expanded in terms of who's eligible. So it used to be a reduction in hours didn't make you unemployed, therefore you couldn't get unemployment insurance. It used to be that if you were in the so-called gig economy, if you're an independent contractor, a freelancer, or a Lyft or Uber driver, that you couldn't qualify. We changed the law for the purposes of this pandemic. And so I do think a situation like that, it's very likely that someone like that could qualify, but you've got to check on your individual situation with the local Department of Labor.
Senator Hirono, anything to add to that?
Sure, just the kind of factors that Brian mentioned. People with more than one job might qualify depending on those factors. And this is why I believe that there's also some serious discussion about direct payments to meet the needs of those folks who do not qualify, like Nelson and some others. So, the focus has to be on what can we do to help our workers support themselves and their families, because this pandemic is not going to end anytime soon. So there is serious discussion, I'd say bipartisan discussion going on about direct payments, more direct.
Let me just add one thing about direct payments, because it's an evolution that I've personally gone through. And if this pandemic doesn't cause you to rethink some things, then I don't know what will. And for me, I was always wary of direct cash payments to individuals. Some of the people that were pushing it sort of in place of the broader social safety net. And it was, generally speaking, not enough money to replace things like food stamps and unemployment insurance. But as I see what happened on the ground in the wake of the CARES Act passing, it was that check from the IRS, or that transfer payment from the IRS, that was the first money to come. And it was really essential to prevent people from getting foreclosed on or evicted or unable to pay for the rent. So, I think we need to maintain a broader social safety net, but in an emergency situation like that, like we're in right now, there's sort of nothing like cash, and cash can be done rather quickly.
Let's stick with this, because direct payments is very important to a lot of people watching. They're going to want to know. Some are going to want to know, how much could that be? Please send me some. And others are going to want to know, hold on a second, how do you prevent that from keeping someone unmotivated from going back to work? I know there's been talk by some lawmakers of a back to work bonus once the $600 plus up expires, for example. So what are your thoughts on how you would provide that kind of relief without convincing somebody it's better to just stay home once the job does resurface?
Whatever formulation the direct payments take, it will not last forever. And I think most people do want to get back on the job. There will be a time limit. There's discussion about maybe we should stagger the payment, decrease the payments as the months go by. So there are different formulations, but the whole idea is we need to provide support for our workers who are going to be, sadly, looking at kind of an extended period of time of unemployment. We don't like it, but there is that distinct possibility, especially as we rely on tourism to come back. And all these people from the mainland are not about to jump on a plane and come to Hawaii unless they feel that they're safe, and that we know that when people get off the plane, that they will not be bringing the virus with them.
Next question. Can you address the concerns you have with how Hawaii's unemployment processing system has functioned or not functioned for several thousands of people laid off during this pandemic? Senator Schatz?
Yeah, it was maddening. I knew many people personally who were very delayed in getting their payments. I was particularly frustrated because I got on the phone with the Department of Labor and the UI folks like 3 or 4 business days after we passed the CARES Act and said, "Are you guys ready?" And it would have been understandable if they said, "No, I don't think we're ready. Actually, we're about to get crushed." But what they told us is that they were ready, and then the claims just piled up and piled up and piled up, and people were suffering and are still suffering. I do think there's a silver lining here, which is that Sylvia Luke in particular, who's the chair of the Finance Committee in the State House, and really doesn't have a specific obligation to jump in and fix the Department of Labor's UI process. But because the session was abruptly adjourned because of COVID-19, she and Aaron Johansson and Scott Saiki and Della Al-Baladi and all these people, they went in there personally and basically staffed up and scaled up and set up systems so that they're now processing claims to the point where I don't know what the numbers are now, but they're sort of in punching distance of actually plowing through all of the claims. And what an extraordinary, I know everyone's frustrated with their leaders and there's lots of arguing going on, but that's a real success story, and that's people going in there. And just so we're clear, this isn't like oversight and a PR thing. They're processing claims themselves. They're doing it. They're spending hours and hours of every day, in addition to their regular duties, in addition to their family stuff, actually working people's claims through. And I'm so admiring of that. And I will tell you that I don't think there's another state where our leaders would jump in sort of at that operational of a level. And it's a benefit of living in Hawaii.
It's admirable indeed. The fact that they even have to speaks to the shameful state of the systems and the
of course
computers and codes and whatever was wrong.
And Gina, it's not
Senator
just Hawaii.
Hirono, how do you tackle that?
It's not just Hawaii. All UI systems across the country needed to be modernized. And yes, I'm glad that the legislators stepped up, because a lot of that money does come from state legislatures to modernize it. It would take billions, literally, but we must start somewhere to modernize the system so that all of the, I would say none of the UI systems where the infrastructure was what it should be. So I'm hopeful that we can start spending some money to take care of the situation, because this is not the last pandemic that is going to hit us. I also want to acknowledge that we also have volunteers from HDA and HSTA going to the convention center and doing what they could to help process the thousands of claims that came forward.
Next question. Hawaii has implemented a 14-day quarantine for travelers, but pretty much all agree that will have to be lifted eventually. To prevent travelers from spreading illness, Wendy Crabb asks, is there a way to mandate that all tourists and travelers can be tested, or at the very least, temperatures taken and health assessments done prior to a traveler boarding a flight to Hawaii? Senator Hirono?
Well, the concern about testing or taking temperatures is that there are a lot of people who are asymptomatic, who have the virus, and the test is only as good as that is positive, and you could be positive the next day. So what we really need to do is have a national testing regime, a national tracking regime, none of which the president is about to implement. And of course, Brian and I and others, we've urged the president to use this Defense Production Act to produce the necessary test kits, all of the things that should be done at a national level.
Senator Schatz, what's your perspective on testing before flying?
I like it, but I think it's important for all of us to understand that we're sort of on a trajectory to try to do some kind of partial reopening for trans-Pacific travel in a safe way in the next month or two. And of course, we're only going to do that if it's safe to do it, but we're going to have to incur some risk, and we're going to have to be realistic about what is available right now to us. I think it's ideal that it would be ideal if we set up something similar to the Department of Homeland Security that kind of integrated all of this into TSA and everything else. The likelihood of us passing a bill and standing up a federal government organization to handle this for us is close to zero in the next 60 to 90 days. And so we've got a couple of options. We've got a kind of pre-departure test where someone could go to a private lab and sort of bring a piece of paper and which says, I have this thing which makes me no longer subject to the 14-day quarantine because the Department of Health says that's good enough for us, go have your vacation. So that's one scenario. The other scenario is that if you select departure cities with low COVID rates, you could probably significantly reduce the risk. Now, you never reduce, as Maisie said, you never reduce the risk to zero, but if you're talking about flights from Haneda, it's a lot different than flights from LaGuardia, right? And so we are in the process of pursuing those sort of bilateral relationships so we could fly, just as for example, Alaska, Honolulu, New Zealand, Honolulu, Japan, Honolulu would be a great place to start. All of those have to be pursued. And then but really what is going to drive public health going forward is non-pharmaceutical, non-border interventions. We shouldn't think of this as, we're kind of standing at the gate stopping everybody from coming in forevermore. And we shouldn't think of this as purely a question of when is that vaccine going to be available. The main thing we can do to stop the spread of COVID is simple. Social distancing, sanitation, universal mask wearing, and contact tracing. And so we're working with the Department of Health, with the Lieutenant Governor, with the Governor, with all of the county mayors to come up with a plan that is safe. And one of the things that I've been saying on these various conference calls with leaders is, look, let's not stay at the conceptual level talking about should we do universal testing or should we have a pilot program with Japan. We've got to pursue all of these all at once and see which ones of these end up being viable and safe. It may be that we can do 2 or 3 different programs, but we've got to get started on the logistics related to what is that form? Is it true that there's a reliable COVID-19 test that the Department of Health will be able to receive and say you're waived? Do we have the legal capability to waive the 14-day quarantine for some people and not others? Those are all things that are at the logistical kind of government operations level. And we're now in the sort of 3 to 5 weeks of, okay, it's go time, because none of these things are worth arguing about if the government isn't ready to start.
There are a lot of moving parts to reopening our airports for flights from any number of places. And frankly, the one thing that will bend the curve of the spread of this virus is if more people will wear masks, do social distancing, wash their hands, do the kinds of things that actually work. And I read somewhere that if something like 60% of our country did that, we would be able to bend the curve of the spread of this virus. So those are things that we need to continue to employ.
Next question. The U.S. Attorney General has warned states not to reopen too slowly or risk abusing constitutional rights. Mike Whitehead asks, do you both feel the government is abusing their power by controlling everything the country does? Why is it not mandatory to just wear masks and open up? Senator Hirono.
The government's responsibility is to keep the people safe from harm, and that is what these recommendations are. I have my issues with Attorney General Barr, I can tell you that, because he's certainly not coming at this from a public health. Let's listen to the doctors and the science behind this. Where he's coming from is he wants to support the president. He is literally a lackey for the president. He is not the Attorney General for the country. The president wants our country to open up. And so here's Barr encouraging protests and all of that across the country. So Attorney General Barr, once again, shows us very clearly who he's the attorney for, and it is not for the people of our country.
Thank you. Senator Schatz, besides it being Attorney General Barr or the people protesting down at the Capitol here locally, is there anything to Mr. Whitehead's argument of, is there some government overreach going on that's gone too far too long?
Well, I don't think so. I mean, I understand the concern, and I think that we ought to be careful as we plan to come out of this pandemic that some of these things should not be the new normal. They should be utilized in extraordinary circumstances. For instance, requiring returning residents to the state of Hawaii to not leave their home is certainly something I support, but only during a pandemic. And so taking Attorney General Barr at his word, and I think Mazie would say, don't do that.
I certainly would.
I think it's worth understanding that we are seeing a sort of an infringement on our normally available liberties to move around as we wish, to conduct business as we wish. But certainly it is within the local and state government's power to do this, and they're doing it wisely. If the question is, hey, this shouldn't last forever, I think that you're going to find very, very little disagreement there. But I sort of agree with Mazie's point at the foundation of it, which is, look, this is Trump sort of admonishing governors who are trying to abide by the best science. And one final thing is just wear a mask. Universal mask wearing, according to a study from Japan, just universal mask wearing, nothing else, results in a 75% reduction in infection rates, a 75% reduction just from one non-pharmaceutical thing. And the only thing is it's a little irritating, it makes your face sweaty. It's worth it.
Yep. And by the way, I would listen to Dr. Fauci over Attorney General Barr on these issues. And by the way, the states are opening, they're easing up, and I'm proud of our mayors for being very smart about how they're going to open certain malls and the parks, etc. But we're doing it safely, and that is how we should ease up on these restrictions.
Lani Kohatsu asks, what are the top 2 things that you're advocating for Hawaii during the recovery process of COVID-19? Senator Hirono.
I would say the most important thing is that we need to provide support for state and local governments to meet their budget shortfalls, because otherwise they are going to start cutting very important programs that our communities rely on, and they will begin to probably furlough workers. That will be terrible. So that's first. We need to continue to support small businesses, and whatever we need to do to oversee all of the money that's already out there to make sure that that is going to the businesses that should be getting this kind of support. And one more thing, we need to support the Postal Service, because if we do not provide them money, they're going to start, they are not going to be able to continue delivering the mail, the medications, the Social Security checks in a few months. Not to mention that we will not be able to do voting by mail, and we will not be able to return our census information, very critical for resources that will be coming to Hawaii. Those are just among some of the things. There's a lot more.
She did just ask for 2, but those are 2 really good
I gave you 3.
local support of the Postal Service. That's an excellent point. Senator Schatz, your top 2 priorities.
State and local funding, for sure. And then secondly, I have legislation to establish a national jobs program. There are some proposals for a national service program out there, which I think are, valid and interesting, but this is kind of different. This is FDR style. The government actually hires people to do work that needs to be done anyway. And sort of, we've already crossed the threshold as a nation that we're going to spend money to sustain people economically during this pandemic period. And so it's no longer a question of whether we're going to pay people during this pandemic period. It's a question of whether we want to pay them to do something or pay them to stay home. And so we've got a $125 billion program that focuses on public health. And let me just give you a perfect example. I just saw last night that a couple of salons are opening up, and they're having to devote full-time staff people to just cleaning. And my own view is that malls and care homes and schools, public and private, could all use a little bit of help in terms of cleaning and sanitation and understanding best practices, because they want to focus on what it is that they do. The service or thing that they sell is what they do best. And so to the extent that we could have, say, 4,000 or 5,000 people in a sort of Hawaii pandemic core out there, people who would otherwise just be taking unemployment insurance benefits, who would be out there making sure that as we endeavor to have a safe reopening in the summer and into the fall, that we're giving ourselves the best possible shot to minimize the infection rate and ultimately the death rate. So I'm really excited about this proposal. I don't know if it'll get in the next round, but I think there will be at least 2 more bills, and I'm going to push very hard.
And with that last question, we thank you, senators, for participating, and we thank you all at home for watching. Please stay with KHON2 and KHON2.com as we bring you all of the important updates and information that you need to know for dealing with this pandemic and our state's recovery. Mahalo and aloha.
Everyone stay safe, be kind.
Aloha, everybody.